Good evening, friends. Thank you, Father Salim Joseph, and thank you, admins, for this opportunity. My name is Shanmuga. Today's session regarding speaking subtest. After this session, you can able to analyze the role play card, and also you can construct your own introduction. I would like to welcome you all for this role play. Is it clear, my voice?
Yes, dear.
Yes, it is clear.
Yes, Shanmuga. Clear.
Okay. Moving on to the speaking subtest. I think everyone knows about speaking subtest. This test, what is the test of this format means? Speaking subtest test, profession based. So it will have their own speaking subtest, each of the professions. It has three parts. First one is warm up session, and second one is first role play, and third one is second role play. Each role play is 5 minutes long. Actually, you have to remember this role play is test your ability in and skills in English, not testing your medical knowledge. So do remember that one. This whole test will take 20 minutes long. Moving on to the warm-up session. This warm-up session, why they have kept means you make you feel more comfortable, and also make you each other voices, familiarize yourself with the interlocutor voices. So whenever you are entering into the interlocutor room or speaking subtest room, they will greet you and they will tell their name. You can use this name while you are speaking card as well. And then they will explain the format, which is I have explained earlier, and then they will check your ID, and also they will confirm your name with your profession, and then they will give you warm-up session. For example, they will begin with warm-up questions like, tell me about yourself, how many years have you been working. For like this, they will ask you some warm-up question to familiarize your voices with each others. And moving on to next one, and moving on to the role plays, they will give two role play cards. First one is they will hand a candidate role play card will be given to you, and then they will let you know 3 minutes time to prepare. During this 3 minutes time, you can ask you can ask and clarify which is not familiar to you, or you don't know how to pronounce some of the words or some of the disease names, that is you don't know. So you can ask the interlocutor, they can tell that how to pronounce or how to uh, pronounce that name or unknown medical vocabularies. If you know the patient, you can ask patient name as well during this preparation time. If you don't know, if you forget to ask the patient name, you can use interlocutor name as a patient name if it is a known case. And then they will let you know once 3 minutes preparation time is up, they will give you 5 minutes for conversation. And the second role play, this process will be repeated with a different scenario. Moving on to the criteria, in speaking, they are assessing us in two criteria. One is linguistic criteria, and another one is clinical communication criteria. Please, if you are having a subtest, if you are having this OET near to the within this month, you have to check for this video that is uploaded in YouTube channels. He is explained clearly and also detailedly. This is just example I have given here. First one is intelligibility and fluency, appropriateness of language, resources of grammar and expression. These four criteria comes under the linguistic criteria, and this is the weightage, more marks than clinical communication criteria. But if you are preparing and you don't have enough time to prepare, you can focus on the clinical communication criteria, because it is really helpful, and also it is really easily developed by you because it is profession basic. So in clinical communication, it is divided into 5 categories. First one is relationship building, second one is understanding, incorporating patient's perspective. Third one is providing structure. Fourth one is information gathering. Fifth one is information giving. This five criteria has 3 marks, so totally it will have 15 marks. But weightage is more than in clinical linguistic criteria, not clinical communication. But you don't have any time, you don't have less time, you can focus on clinical communication criteria. Today's session based on relationship building. Anyone knows what is relationship building? Please, you can unmute and tell what is mean by relationship building.
Understand the patient,
Get
make a
strong
rapport with the patient.
Yes, understanding the patient, and also you have to make trust, establish the trust and rapport with the patient. Then simply said, good communication, that is relationship building throughout your conversation. How you can make good communication skill? Through active listening and also providing sympathy, empathy. If you can see this clinical communication criteria, first criteria is relationship building. In first criteria, there are 4 aspects we have to consider to opening role play. Many of the candidates, I think, they are what is meant by relationship building means they are considering as opening the, I mean, starting the role play. It is not like that. If you are go through this clinical communication criteria, you can clearly understand how to open your role play. You can see here, first point is initiating the interaction appropriately. What is mean by appropriately? It is nothing but properly, or it is suitable to the situation. So moving on, here you can see greeting, introduction, nature of the interview. Greeting could be anything: hi, hello, good morning, or good afternoon. Anything it could be. Even it can be patient name, you can call patient name as well. It can take greeting. And introduction, you have to introduce yourself with your job role, your name and your job role. And moving on to the next one, nature of interview. Nature of interview means you can see the background information, and you can see the first task. You can start the role play. How you can start the role play, we can see it in example. Yes, during 3 minutes preparation time, you have to notice first one and understand the setting and understand the background information. Look for the task that may be hidden in some way. If you are not understanding the settings, you cannot able to open the conversation clearly. If you are not understanding the background information also, it can lead different introduction. So you have to understand the settings. Means sometimes settings can tell it is a unknown case or known case. For example, emergency accident means it is a unknown setting. Most probably it is a unknown setting, but there are settings comes, it come patient as a known case. We can see the examples and understand the background information. You can confirm the patient is known or unknown. So look for the task that may be hidden. What it is mean you can read the background information. There you can see some words like anxious, frustration, or for any other word, worried, like that. If they have mentioned, you can pick that point, you can ask from that question. So moving on to the examples, here you can see the row. Thank you OET for the free samples. I have used this material from the OET. You can see here setting is clinical communication, community health center, and this is nurse card. You can see here, you see a 57-year-old patient who wants some advice about his or her swollen feet or ankles. The task is given. First task, you can see, check the patient's reason for the attending the health clinic. Whenever you are seeing the setting, it tells us no unknown patient. Community center, so community health center means most probably they don't know patient, but we cannot conclude that one. But if you are reading the background information, it has not given any information that you have seen the patient recently, so you can conclude this is unknown patient. So how you can open the role play with the examples? First one, you can greet the patient. Hi, hello, mister. If in UK or European countries, they will book the appointment and they will give the name in the reception. With that name only, they will call us. So if you know the name, patient name, you can call Mrs. Johnson. Is that okay if I call you Johnson? You can confirm, you can respect their wishes, or if they don't want to call their name Johnson, they will give you the name. So you can ask in that way. Other way, you can ask, hello, Mr. or Mrs. Good morning. How can I call you? Like that, you can ask. Or else you can ask, what would you like to prefer to be called? Like that, you can ask some questions and they will give you the name. Then you can continue with the introduce yourself. Here you can introduce, hello, Mrs. Johnson. I'm Shanmuga. I'm a registered nurse working in this center. Here nothing given in the background information. Patient is anxious or frustrated, so it is not applicable. And the nature of the interview, you can ask, always remember that your questions starting with open questions so that your marks will be higher. If you are starting close the question, it will lead less marks. So try to remember, whenever you are opening the conversation, do use open question. Here you can see, could you tell me the reason for your visit? First task, you have to remember that check the reason for the visit. And moving on to another example, here you can see the setting, that is hospital, accident and emergency department. Here you can see the background information that has given. You see a 40-year-old who has come to the emergency department with a burn on his her foot caused by dropping an iron on it while ironing this morning. You have just examined the food while assessing the patient in triage before she or he sees a doctor. You confirm it is a superficial burn. How can you open this role play? Please, any volunteer, how would you open this role play?
First, we can ask, how are you? How do you feel?
Is it appropriate here?
Do you have any pain?
No. How you will open the role play here? What is the first task here? You can see, confirm the presence of blister and a white patches, that is superficial thermal bone. And in first task, there is one subtask, that is explore the measures already taken. So you have to moving on to the next slide. I will show you the example. In this card, here we no need to introduce ourselves because we are in the middle of the conversation. We have already examined, greeted the patient. We have introduced ourselves. In that case, if you are going to introduce your name, hello, I'm so and so, I'm working in this emergency department, it is not right. So we can open our role play like, thank you for allowing me to examine. Yes, I can see there is a presence of blister. That is confirmation of your diagnosis you are giving to the patient. Now you can ask the subtask from the first task. Explore means you can ask, could you tell me the how have you taken any first aid? Or you can ask any other questions, tell me any measures have you taken at home? Like that you can begin your role play. I hope it is clear now. And moving on to second aspect, that is be attentive. Be attentive or respectful means, be attentive simply it is listening to the patient. Getting permission. Here, getting permission, do you mind if I ask you few questions about your health? If whenever you are asking question, you can ask the permission from the patient, and you have to actively listening to the patient. You can see the second point here. It is also mean when you are listening carefully to be reflecting back what the patient said. It means simply listening to the patient, it is not showing active listening. So if you are reflecting means you are repeating back, so that is echoing. So if you are repeating back to the patient, that shows that attentive behavior towards the patient, and also it will be respectful one. You can see here example, how long, the nurse is asking, How long have you been having this cough? Patient is telling it started about 2 months ago, but there seems to be worse since last week. Now nurse is telling, okay, so it started 2 months ago. It means we are repeating the information to the patient. And go is that right? Like that, we are repeating the information. This shows attentive behavior. This attentive and respectful behavior we have to continue throughout our discussion. If you are not listening, if you are not attentively listening to the patient, you cannot able to answer appropriately. If they are asking question, in that question you have to answer that question. You are not able you cannot provide sympathy empathy there. After answering the question, you can provide sympathy empathy over there. And moving on to the next slide. Here you can use simple words like okay, but try to minimize these things, because you have to avoid interruptions. If you are frequently using these words, it could interrupt the patient. Simply means this active and attentive behavior, respectful attitude means you have to allow the patient to speak at least 50% of your speaking subtext will not be a monologue, should be a conversation. I hope it is clear, guys. And what is the
Yes.
third aspect? Third aspect here is non-judgmental. Everyone is well aware about what is judgmental and non-judgmental. In writing, you all know how to write uh, non-judgmental way. That is, you cannot use the smoker, you cannot use obese, you cannot use alcoholic, like that. These words are considered judgmental. How you can be a non-judgmental in speaking? Here, same way in speaking, if they are approaching, for example, you have to give information to the patient that is stop smoking. How you can give the information in tactful or being non-judgmental way? You can say, here, it's been difficult to stop smoking, but would you be willing to try reducing the amounts of cigarettes? That is the way we have to ask the patient. If the patient is telling, I will smoke 10 packets of cigarettes per day, but you know that is quite quite not good, but you don't have rights to say that you have to stop that smoking. But instead, if they are approaching, I need to stop smoking, I don't have to, I don't know how to stop, like that they are approaching us, we can tell them there are many measures, there are support groups, there are nicotine gums, like that you can explain to the patient. Unless they are not approached, we don't have any rights to tell the patient to stop smoking. And another example you can see here, overweight. It is our task. Change your diet plan. Here also you cannot say you are overweight, so you need to change your diet plan. But it is not our right to tell the patient you have to change the diet plan. But we have to respect that decision as well. That is the thing. It will show attentive and respectful manner, and also remaining non-judgmental way. Here there is example. It is important to include vegetables and fruits in your diet. However, it is understandable sudden changes is quite difficult for you. It is right time to start changes in your diet. Do you think can you do that? You can see here I have stopped with the question. You are getting permission to the patient. Will you able to do that one? Like that, if you are asking permission, you are giving suggestion. Everything you can see in this example, so that you will be able to remaining non-judgmental. And also you can ask permission from the patient. You are respecting their willingness. If they are telling, no, I cannot start changes, means no problem. You can if there if our task is persuade or anything, it is strongly recommended, but it is your decision, like that we can say. But in that case also we cannot say you have to do that one, you must do that one. No, it is not like that. You have to tell the patient tactfully. It is strongly recommended like that. And moving on to the final one, that is fourth aspect, showing empathy. Showing empathy, everyone knows how to be empathy, right? Here, showing empathy means don't worry, I can understand. These are all the words actually. I'm not telling it is not right, it is right, but if you use appropriately, you can, if a patient is telling my pain is so severe, but if you are replying, I can understand, what you can understand there? No, it is not good way to tell the show the empathy to the patient. Here example you can see, if you are being very attentive, you are also being very empathetic. As long as you are listening to the patient, you can give so much clearly to the empathy to the patient. For example, you can see here, if you don't know how to give proper empathy to the patient, you can include the reason with I can understand, or don't worry, it is really difficult, I can understand that you are feeling so much of pain. Unless you are putting your unless you are not involving with your patient, unless you are not putting your feet on the patient's shoes, you will not give proper empathy to the patient. So do practice this proper empathy, how to provide empathy. If you don't know really, please add some reason, whatever the reason patient is giving to us, you can add that reason. Here you can see, if patient is telling stop, not willing to stop medication, you can tell that, okay, that must be difficult stopping your medication or changing your diet so suddenly. You can see here there is reason. Stopping your medication is the reason. It must be difficult. You don't stop from there. You have to continue. Stop. It must be difficult stopping your medication. I can understand that. Like that, you can use reason for the with a reason, but that phrases or sentences whichever you are using. And another example, I can see this is very difficult for you, and to manage your condition alone, that is, if there is patient diagnosed recently diabetes, no one is there to support her or his. So in that case you can inform them, you can give empathy to the patient, how you can give, it is really difficult to manage your condition alone, don't worry, by practice you are able to do injection yourself. Like that you can provide empathy and sympathy to the patient. And there is one more example, many parents are, if there in someone, I mean your patient is not willing to use cream or any other medication, you can tell that, please, I think many of them worried about using that steroid cream or medication. I can see there are more lots of questions or queries or concerns about it. If you could tell what is exactly bothering you, I can provide more detail about that one. Like that you can provide empathy and you can ask the question, why they are more concerned, why they have that queries. And moving on to the next slide, here there is one setting. Here this is hospital outpatient clinic. Here our card is, no, you are giving a 52-year-old patient information about a transesophageal echogram he or she is going to have next week. First task is confirm the patient is scheduled to have a transesophageal echocardiogram, and the subtask is find out the patient has had one before. How would you open this conversation? How you will be attentive to the patient? Is the patient is known patient or unknown patient? Is there anyone answering this question, please?
This patient is non.
Unknown case. Unknown case. Unknown patient.
It's a non-case. Already there is an appointment. I am confirming with the patient. Like, ma'am, you have an appointment for such procedure like a transesophageal echocardiogram, right?
Yes. It is, you can see here outpatient clinic. Maybe you know the patient, but sometimes the staff doesn't know the patient. You can confirm. You have their records. It is a partially known case. So here you can open the role play. Here you can say, hi, hello, I'm Shanmuga, a nurse from this clinic. Is it Mr. John Smith? Because you know the patient details, you have the patient details, so you can call their name. He will tell, yes, that's right. So you have to ask them, is it okay if I call you John? You are confirming the patient, is it okay if I call you John? If patient is telling, yes, you can call me John, or you can call me Smith, like any name, whatever it is the patient telling, you can ask, go with their name. Okay, John, could you confirm? Here you can clearly see, confirm the reason. Here you have to use that word, or um, you can use, could you confirm the reason for your visit? Or you can use another way, you have been scheduled for transesophageal echo. Is that correct? Like that you can ask the patient, then he will tell, yes, I have been scheduled. And that, in that case you can ask, find out he has had any other one. In that case you can ask, did you undergo this closed question, had any esophageal echocardiogram like this one before? Like that you can ask the question, you can start your role play.